Hello.
Hi, Hanju. How are you? What are we doing here?
Come on in.
Okay.
And first,
Oh, hand
you have the hand sanitizer.
All right. All right.
We do.
What do you feel about the elbow tap?
Oh yeah, that's a good idea. I see a lot of people doing this.
Okay.
Actually, I'm not as keen for it because we are also trying in public health to get people to cover their cough. If they don't have a tissue, they can cough into their elbow. So maybe this elbow is not actually becoming that clean anymore.
Okay.
Why don't you come on in?
All right.
Great. So nice to see you.
It's nice to see you, Bob. Oh yeah, I was about to give you a hug. I know. I
You
totally
guys,
forgot.
it's not
Oh,
6
that's right.
feet.
That's right. Okay.
Sit down.
All right.
Okay.
All right. Good.
Between you is 6 feet.
Okay.
Between me and Bob, 6 feet. And Cheyenne.
Wait, but you're my wife. I can be closer to you.
No exceptions.
I think that brings up a good question, Bob. What about immediate family members? Do those 6 feet apart rules apply to them?
No, the main thing for immediate families, they can be together. It's an issue of having lots of other people coming into the house. And I think that's something really important to understand too, is that we all are in this together, as one human family, if you will. Even though this disease does not appear to be very serious in young people. They shouldn't be saying, oh, well, I've got a pass, so I can go out and do anything I want to do. No, they have to recognize that they have parents, they have grandparents, they have family or friends that may have immune system compromised, let's say undergoing chemotherapy, things like this. And so they're making sure that they follow some of these social distancing factors so that they don't get infected, and then they don't bring it back to the immediate family is very important.
So what is it about 6 feet apart that makes it a magical number?
Good question. Actually, it's the fact that this disease, COVID-19, appears to be primarily transmitted by droplets, which is what you have, like you cough or something like that. And those droplets are relatively heavier particles, and so they drop to the ground relatively soon. So usually actually within 3 feet, but out of an abundance of caution, we're saying 6 feet.
Is this far enough?
It doesn't need to be that far.
What about covering your hands?
Not with an oven mitt. There can be times when you might want to be able to use a glove. For example, if you're caring for someone who's sick, or if you have illness, you don't want to be giving it to anyone else. Certain times, and certainly health workers in healthcare settings, they're using, again, surgical type of gloves, not oven mitts.
I know a question that a lot of people are asking is, how can I be of service? What do you think that people can do to kind of help in these situations?
I think it's important that at this stage to recognize that there are things that we can do. In fact, even this issue of covering our cough, washing hands frequently, are helping us to prevent infecting other people.
You know, it's kind of like that concept of preferring others over yourself. And by doing so, we're actually keeping each other healthy.
We have to begin to think of the world as one human family. And so I think we have to really recognize this interdependence of the world and the fact that we all need to play our part and we all need to support those who are most vulnerable in other countries as well as our own.
There must be some magical properties in toilet paper. Would you like some?
No, remember 6 feet, and we don't need extra toilet paper. People are hoarding it, but we're not going to use any more toilet paper with COVID-19.
If you touch toilet paper and then someone uses it, can they get the virus from that?
No. I suppose if they coughed on it and then you ate it.
Then, okay. So don't eat toilet paper is what you're saying.
That's right.
So there are a lot of rumors that I'm hearing about this disease. Where do you go to get your information?
I think anytime you have a pandemic situation like this, rumors start flying. And as the WHO Director General Tedros said, we need facts, not fear. We need science, not rumors. And we need also solidarity, not stigma. Sources of information that are very helpful are from our National Centers for Disease Control, the World Health Organization, and then also our own state in California. And then locally, we have the Los Angeles County Department of Public Health. And they have a website. Every day is being updated, how many cases, what you can do for yourself personally, and also what can you do for the society with the social distancing.
This was super helpful. Thank you so much for your time.
Happy Nowruz.